Ciao, everyone. I am Samantha Tamarchio, a licensed marriage and family therapist that specializes in trauma, sex, and relationships through an attachment-based and somatic-oriented framework. So today, I would like to give some simple tips for my AFAB folks, femmes, and women who struggle with painful sex. Stay tuned for the end of this video as we will go over a breathwork exercise to relax and engage your muscles in the pelvic floor. But first, it's important when it comes to painful sex that we rule out any medical related issues, so making an appointment at your OBGYN is essential and the first step. Then, once cleared by your gyno, I highly suggest getting a second opinion. If it wasn't referred to you already, make an appointment at a pelvic floor therapist. Now, it's important when you first start with a pelvic floor therapist that your therapist does internal vaginal work for the majority of your session. You can advocate for this when you are initially speaking to your PT to get a sense if you will be a good fit to work together. Now, if it's through insurance, just make sure that they provide some internal work because the external work, what I've seen in my practice, tends to be less effective and impactful when it comes to alleviating your symptoms. As you will see the most immediate and long-lasting results of your symptoms through the internal work of the PT. So, sex therapy works great in tandem with pelvic floor therapy because in the therapy room, we address the psychosomatic and emotional dimensions of pelvic floor discomfort that is often the culprit of vaginal pain during sex. So here's some simple exercises. Actually, I'm just going to give you one. So just one simple exercise that we can do together is a breathwork technique. So think of it as like step one of sex therapy and pelvic floor therapy combined, right? If we're working in tandem together. As a technique that can help you release and relax your pelvic floor. So we'll get right into it. Taking a moment to just get comfortable. So whether if you're seated on the floor or you're seated on a chair, just make sure that your sit bones are rooted into the surface beneath you, and that if you're in a chair, that your feet are rooted into the ground. And just take a moment to get your surroundings, just kind of orient for a moment, kind of check out the room. And allowing yourself to be in a more private space, so a space that you can feel free to release a little sound and a little auditory exhale breath. So, just taking a moment now, so you can have your eyes closed or have a soft gaze down at the floor, and place one hand on your belly and the other hand on your lower abdomen near the pelvis. Take a moment to breathe in deeply. So inhale deeply through your nose, directing the breath down into your belly. Imagine your breath traveling all the way into your pelvis. Feel your belly rise under your hand. And exhaling, relaxing more deeply into the support beneath your seat. Allowing for another deep inhale. As you inhale, visualize your pelvic floor softening and expanding like a hammock, gently lowering or a flower blooming. And as you exhale slowly through your mouth, making a soft sound, ah, allowing your belly to fall naturally as you release the exhale. Imagine your pelvic floor relaxing further and melting away any tension. So as you inhale, expanding your belly. And as you exhale, releasing that auditory sound, really relaxing any tension that you're holding on to, letting it go. And continuing with this breath at your own rhythmic pace. Inhaling deeply through the nose, directing the breath down into your belly, imagining your breath traveling all the way into your pelvis, feeling your belly rise under your hand. And as you exhale slowly through your mouth, making the soft sound, melting away any tension in the pelvis and the pelvic floor. And continuing this inhale, exhale breath, and allowing for your jaw on the exhale to stay relaxed and slightly open, as the jaw and the pelvic floor are neurologically connected. So if you're holding tension in your jaw and clenching your jaw, you're going to be holding tension in your pelvic floor. So allowing your breath to come back into your own rhythm. And with each breath cycle, mentally repeat this little mantra phrase: soften, release, exhale. Soften, release, exhale, let go. Soften, release, exhale, let go. Focus on letting go of tension in the pelvic area with every exhale. Now, continuing this cycle of breath for another 5 to 10 minutes. I highly suggest getting into a rhythmic pattern, as creating this breath is a part of your own practice. It can be in the morning as you're drinking your coffee, it can be before sleep, or even when you're after you've brushed your teeth. Just weaving it into your day as a simple practice that you can do that helps bring you into more connection and deep awareness into your pelvic floor, genital, lower abdomen, belly area. Because oftentimes we feel that we're relaxing when we're actually holding patterns of tension in the body. And the tension is what creates the contraction and doesn't allow for the space to really receive. And so when we're in a more relaxed space, we create more openness. There's ability for our bodies to feel more pleasure. We can open to more pleasure when we're able to let go. So, a little reminder, little tips for this practice. Always practice in a quiet, comfortable space that you feel safe and open. This breathwork technique is not about forcing relaxation to happen, but inviting it with more curiosity, compassion, and presence. Any sensation of tightness or emotional release is normal. So if you start to feel anger or you start to maybe tear up, let it happen. Allow it. That's why creating the safe space before you start the exercise is really important, to allow whatever it is to come up, be present. So again, this gentle exercise can just be a simple grounding support to deeper relaxation and connection to yourself, your body, your sexuality, your pleasure, and any emotional release that comes from within the body, to just let it go. So, happy practicing. Thank you so much for listening, and follow me for more tips and tricks in the bedroom. Ciao for now, tutti.